Labetalol. Labetalol acts as a dual antagonist, blocking both alpha-1 and beta-adrenergic receptors. The delivery room emergency. A 28-year-old woman at 36 weeks of pregnancy suddenly develops a severe headache and blurred vision. Her blood pressure is 210 over 130 millimeters of mercury. The obstetrician needs to lower her blood pressure within minutes, but without significantly reducing blood flow to the placenta or causing dangerous reflex tachycardia. A drug is given intravenously. Within minutes, her blood pressure falls smoothly, her heart rate remains relatively stable, and both mother and baby are protected. How can a single drug lower blood pressure by both slowing the heart and relaxing blood vessels at the same time? The answer is labetalol, a unique adrenergic antagonist that blocks both alpha-1 and beta receptors, making it one of the most important drugs for hypertensive emergencies, especially during pregnancy. Mechanism of action. First, beta-1 blockade in the heart decreases heart rate and myocardial contractility, reducing cardiac output. At the same time, alpha-1 blockade relaxes vascular smooth muscle, producing vasodilation and lowering peripheral vascular resistance. Normally, vasodilation alone can trigger reflex tachycardia, but because beta-1 receptors are simultaneously blocked, this compensatory increase in heart rate is greatly reduced. The combined effect is smooth and effective blood pressure reduction with minimal reflex tachycardia. This balanced hemodynamic control explains why labetalol is particularly valuable in hypertensive emergencies and hypertension during pregnancy. Clinical uses. One of its most important indications is pregnancy-induced hypertension, where it is a preferred antihypertensive along with methyl-dopa and nifedipine. Intravenous labetalol is also widely used in hypertensive emergencies because it produces rapid and controlled blood pressure reduction. Another important indication is pheochromocytoma, where combined alpha and beta blockade helps control both vasoconstriction and excessive sympathetic stimulation. Finally, labetalol can be used as maintenance therapy for hypertension in selected patients, particularly when its combined hemodynamic effects are advantageous. Adverse effects. The most common is hypotension, particularly postural hypotension, because alpha-1 blockade causes vasodilation. Beta-1 blockade may produce bradycardia by slowing the heart rate. Since labetalol also blocks beta-2 receptors, it can cause bronchospasm, so it should be avoided or used cautiously in patients with asthma. Another interesting adverse effect is scalp tingling, which is considered a characteristic, usually harmless, and often transient side effect of labetalol. Key takeaways. To summarize, remember 4 key takeaways about labetalol. First, it produces dual blockade by simultaneously blocking alpha-1 and beta receptors. Second, this unique combination lowers blood pressure with minimal reflex tachycardia, giving it an advantage over pure vasodilators. Third, labetalol is one of the preferred antihypertensive drugs in pregnancy, particularly for pregnancy-induced hypertension and hypertensive emergencies. Finally, always watch for adverse effects such as postural hypotension, bronchospasm due to beta-2 blockade, and the characteristic scalp tingling.